Hello, this is Dr. Lahari from Leo Dental, Bangalore. Diabetes is the most common chronic disease that has been affecting more than 37% of the total world population in the global level. So there is a time when only a very few people were affected by diabetes. But these days, due to altered food habits, altered physical activity and altered human biology from inside also, diabetes has emerged as the number one chronic disease that is almost affecting 50% of the population. It's a surprise that someone above 50 says that I don't have diabetes. It has become a common household and a household name that diabetes has become so common that nobody bothers about diabetes these days. So diabetes affects your body on every level. It doesn't affect a single organ or a single system. It affects your body on a whole. According to American Periodontal Association, periodontal disease or the gum disease is the sixth most common complication of diabetes. So our mucous membrane, our gums are the softest parts of the body after eyes that are exposed to outside. When a person has diabetes, it definitely affects the renewal or the repair or the regenerative rate of your gums. So in a patient with diabetes, gum care should be the prime concern. What are the chief problems that you see in a patient with diabetes? First thing is the change in the gum color, change in the gum texture, bleeding from the gums. And accidentally, if your gum is getting damaged, there won't be a faster repair of the gums, and mobility of the teeth will be very fast. So your tooth would be stronger this year. By the same time next year, you feel your teeth are mobile or spaces start appearing or teeth tend to go into uneven positions, all owing to the double effect of diabetes. So what we should do? We have diabetes and we have to keep our mouth clean and we have to save our teeth. The first thing we advise a diabetes patient is the frequent scheduling of appointments. If a normal person is seeing a dentist twice in a year, a diabetic person should mandatorily see a dentist at least 4 times a year. And scaling or cleaning is like a holy thing for a diabetic patient. Every 3 months, without any postponement or any procrastination, get your teeth scaling done and use a gum gel or a gum toner that has been suggested by the doctor to improve your gum health, and keep monitoring your gum status and any change, color change, texture change or appearance of pus bullae here. Very frequently diabetes people tend to get pustules or small boils like thing on their gums which tend to release pus on exertion of pressure. If you are seeing these things on your body, on your mouth, that indicates a poor diabetic control. Then you have to go back and check your diabetic status also and keep it under control. Mouth actually acts as an indicator for a proper diabetic control or a improper diabetic control. Diabetic people have to be very careful, or else a small injury or small periodontal damage will ultimately lead to the loss of the complete tooth. Tooth tend to get mobile very easily. So any diabetic patient should go for a dentist very frequently, get their teeth scaling done immediately. You notice any need for root canal or a crown or a gum treatment, just don't delay it. At the first sign of pus, antibiotic coverage should be started, and a proper surgeon, a dentist, should be attending to him very regularly. With a proper dental care, every diabetic patient can retain their teeth throughout their life. It's not mandatory that a diabetic patient should lose their teeth. With a proper care and with a guiding dentist, you can have your perfect smile forever, even suffering with diabetes. So I hope this video was useful, and diabetic people, Please don't neglect your smile. Take care of your teeth and gums.